Have you ever wondered how gonorrhea looks on a man? Well, we're talking about that today. I'm Dr. Perkins. I'm a board-certified OBGYN, and welcome to my channel. In today's video, we'll be talking about several things, including what is gonorrhea, how this infection looks on a female versus a male, what possible damages may occur in your body if you have gonorrhea, especially if it's not treated, and lastly, we'll talk about the cure for gonorrhea. So gonorrhea is an infection that can affect multiple different places of your body. It is a sexually transmitted infection. So whenever we say STI, sexually transmitted infection, versus STD, sexually transmitted disease, there's a very slight difference between the two. And I kind of want to talk about that quickly so that we understand that they are very similar, but they're also a little different. Infections can be cured. Diseases often will stay with you and it's a part of you. So if you have chlamydia or gonorrhea, that's an infection that you can cure and get rid of. But if you have something like HIV, it is not curable. So that's kind of the difference between the two. So throughout the video, I might state STI or STD, but know that I'm referring to infections that are sexually transmitted. Now, gonorrhea may affect the mouth, the genitals on males and females, so the vagina, the penis, the urethra, the cervix, all of our spaces down there, and similarly around the penis of a male. Gonorrhea is spread through any kind of contact with a person who has the bacteria living on their bodies. So for instance, if you have oral sex and the person has gonorrhea, then you can transmit it to wherever the contact is made, so from mouth to genitals. If you have genital to genital intercourse, female to female, male to male, male to females, you can also spread that just the same. Anal sex will do the same and allow you to transmit that bacteria. And this infection can also be passed from a mother to a baby during childbirth. So it's very important that if this infection is present for many different reasons, but if you have this infection, it is very important that treatment is done immediately so that you reduce the amount of spread that happens from person to person, as well as decreasing the likelihood of passing it on to a newborn. Now, gonorrhea has been on the rise, just like many other STDs in the last few years. And we find that this infection is more common between the ages of 15 and 24. We still see infections above the age of 24, but most are in the younger population. If you think you may have been exposed or that you might have this infection or any other type of STIs, it is very important that you go to your doctors right away so that testing can be done. The treatment for one infection versus another can be very, very different. So knowing exactly what it is that you have would be best. And there's nothing that is available at home in the pharmacy that you can get on your own over the counter to treat any type of these STIs. So how does your healthcare provider know that you have an infection? Well, they will take a sample from either your urethra if you're a male or from your vagina if you're a female. In both males and females, you can also give a urine sample for the test to be done. This sample will be collected and your doctors will ship it off to a lab. They'll do some testing and then they'll give you the report of whether or not this has been shown to be in the specimen at all. With gonorrhea, you may not have symptoms at all, nothing. And so you may not even know that you've been exposed. And this becomes a problem in the medical community because many people will go a very long time without doing any kind of STD testing, and they have this infection within their system and not have any clue that it is there. And if you have sex with other people, you may pass this infection around. And this is why it is so common in the younger population and why it is still on the rise. Like, we have not been able to control this infection because no symptoms are often present. Now, if you're enjoying our conversation today so far and the topic that we're talking about, go ahead and click subscribe to join my channel so that you can be updated when more videos are out on topics like this and more. Also, like this video so that I'll know more of the type of content that you like to hear about, and so that we can be in this relationship together long term. So now let's dive into what symptoms do males have, or how could you possibly know if a male has gonorrhea? Well, one of the most common changes, if any, remember, they might not have anything at all, no symptoms, but if you do, what's more common is that there might be burning with urination. And if this is happening, while it might be due to many other things other than just gonorrhea, it is very important that that be the first signal to go get tested. Some males may also have a discharge that is coming from the tip of the penis. And that discharge can be of a different color. So it could be yellow or green, or sometimes it could be just frothy looking and not necessarily with a distinct color to it. But again, if there's any kind of discharge that is unusual, it really behooves you to get tested and check to see what is causing that. Males may also have swollen testicles. And the reason for this is that the infection may be started somewhere on the outside skin of the penis, on the tip of the penis, but that infection can migrate throughout and start to enter the rest of the genital system in males. And so in the scrotum, in the testicles, this is where infections can often reside and live and cause swelling. And with that, most males will notice that swelling is occurring in the area, that there's pain either in one testicle or in both. And just as I mentioned earlier, it's time to be seen if there are any symptoms at all. Now again, I'm going to reiterate, most people with gonorrhea do not have any symptoms. So in the small few that do, these may be the common signs that you may see. Gonorrhea can also occur in the anus, and the same type of symptoms, if any, can be present there as well. So from the anus, you may have discharge. That discharge could be yellow or green. You can have swelling or pain, especially with defecation. Whenever the anus or the colon is very swollen or inflamed, it can cause pain when poop is trying to pass through. And so understanding what your poop is like and the feelings that you have when you're passing your bowels is very important to know the health of your anus. A small amount of people with anal gonorrhea as well may have soreness, itching, or even bleeding with their stools when they have this infection. The symptoms for females are very similar. Change in your discharge, that discharge may be yellow or green. You may have soreness or irritation in the vaginal area. You may also have irregular bleeding, such as bleeding or spotting in between your periods. Again, if anything feels unusual, see your doctor. Now, let's talk about the cure for gonorrhea. It is very important that if you get this infection, that you start treatment right away. The treatment is usually with a single injection. It's a one-time treatment. It's very, very easy and very simple to get done. Now, 7 days after the treatment has been started, you should be cured of gonorrhea. During that time, it's very important that your partners get treated as well, because if they have it and you get treated and you have sexual intercourse again, you can transmit the infection back and forth between the two of you. So very important that all parties are treated, and wait 7 days after treatment has been completed before having intercourse again. Now, know that gonorrhea, if it remains inside of your genital system, your reproductive tract, what can happen is that gonorrhea can cause serious damage to your internal organs. It can lead to you having infertility in the future, having problems with your organs being stuck together, or causing scar tissue on the inside of your body, as well as causing bigger infections like pelvic inflammatory disease. And so to prevent all of this from happening, get treated right away. Thank you all for being here today. It's been a pleasure. Go ahead and click the link below so that you can get a free copy of my ebook, Hormones Don't Lie, to learn more about how to balance your body, balance your hormones, so that your body can be the strongest and the best version of itself. It's been a pleasure as always. I'm Dr. Perkins. Thank you for joining me.